Well, good morning, one and all. My name is Jane Michelle Clark, and on behalf of our company, Cloud Managed Networks, and our partners Ingram Micro and Cisco Canada, I'd like to thank you for joining us to talk about some of the IT-related developments, opportunities, and challenges that are currently impacting hospitals, clinics, long-term care facilities, and larger health networks as well. I'd also like to introduce you to Sina Radfur, who is a security specialist at Cisco Canada. Sina?
Hi, everybody.
Hi.
So I cover Cisco security for Central Territory. It's a pleasure to meet everybody.
Thank you, Sina. Together, Sina and I will be highlighting some of the concerns that have been expressed by people in your positions and providing a few suggestions on how to combat these challenges. Because there are others on the line, we're going to mute all of your connections in a moment. We will open it up again, though, halfway through so we can hear your questions and comments. If, however, you would like to ask something during the session, please feel free to write a note in the message section, and our moderator will make sure that it gets read. First, though, a little bit about us. The founders of the company spent the early part of their careers gaining expertise in the areas of network architecture and management, connectivity, security, and other essential IT knowledge matters. And then in 1998, they founded Cloud Managed Networks. In the early days, Cloud Managed was one of the first companies to start working with Meraki, and indeed was the largest seller of Meraki products and services in Canada for many, many years. When Cisco acquired Meraki, Cloud Managed made the decision to sell all Cisco products, and today is 100% Cisco plus managed services, of course. One of our special areas of focus is the healthcare sector, and we work with hospitals, clinics, and retirement homes as well. In terms of how we work, what we like to do is to understand what your needs are, and then to assess the challenges that you're facing, and then provide you with options that will work within your budget. But if all you need at the moment is something as simple as getting a quick quote on a piece of hardware, we'd be happy to help you with that too, of course. This past spring, though, after seeing events unfold in the news and hearing comments from some of our clients, we reached out to healthcare providers across the province to learn what developments got you excited about your jobs, and more importantly, what was keeping you up at night. And here's what we heard. According to PricewaterhouseCoopers, the top risks facing healthcare providers right now are pressures associated with rising costs, the opioid crisis, potential added strain on resources that might come from your facilities being used because of natural disasters, IT security threats, and, of course, changes in provincial healthcare policies and practices. So I'm sure it's no surprise to hear that the last item on that list was the first thing raised by most of the people with whom we spoke. Ontario's integration of the LINs and other agencies has a lot of IT specialists wondering what on earth it will all mean moving forward, especially since there's a really big push to move patient care from hospitals down into the community. Even then, it likely won't be enough. There won't be enough long-term beds to accommodate the increased demand that's anticipated as a result of all the leading-edge boomers now having started to turn 80 and starting to need these spaces. This means that there's likely to be a far greater demand for in-home care than was talked about, and we will all, and you especially, will need to figure out how to integrate these various care providers under the new Ontario Health Hub. Whatever changes are made, naturally, it's going to have a big impact on the IT infrastructure that's supporting all involved. The new Ontario model is really similar to what's already in place in BC and Alberta, but the integration of those networks took a lot longer than was expected, and it wasn't without a hiccup or two. So a few of you, I understand, are worried about how things might go down here. And although increased funding has been made available for hospitals and organizations that provide services related to mental health and addiction, many of the people with whom we spoke said there may not be enough resources, financial or personnel, to be able to implement the virtual care requirements while also doing more to protect the EMRs now that so many additional people will be connecting regularly and accessing the same data. Some of the solutions that Cisco has developed for the healthcare sector are going to reduce your operating expenses while improving workflow, which will help, but the return on that kind of investment won't be immediate. What is on the immediate horizon, however, is the need to consolidate. As we talk to many of the players who are going to be syncing their patient care offerings when the Ontario Health Teams are formed shortly, in the fall that is, it was clear that not all entities are at the same level in terms of network infrastructure, security tools and practices, and their levels of experience. Those of you who are responsible for broader networks know that you're likely going to be taking a lead role and are trying to determine the best way forward. And for those of you who are looking for extra advice or just a sounding board, we would be very happy to be able to provide input. For years now, organizations around the world have made enormous investments in EMR, EHR, depending what part of the country you're in, implementation, spending millions and in some cases billions of dollars in the process. And in many cases, the administrators are really excited about the move from paper to digital when they start hearing about it because it brings with it the promise of greater efficiency and productivity with all the attendant returns that you'd expect from having the right people having access, or broader access to patient data. Unfortunately, what we've been hearing, however, is that organizations are not fully considering the infrastructure upon which these highly complex systems have to operate. And if I were to paraphrase Shakespeare, for want of a switch and a router, the EMR was lost. That may be a little bit esoteric, but Shanti Gidvandi, who was a nurse and now has a master's in health admin among her many credentials, is the National Director in Healthcare for Cisco Systems Canada. And she is instrumental in helping Cisco to develop healthcare innovations and at the same time help leaders incorporate them into their hospitals, clinics, rehab facilities, long-term care properties, wherever they're working. So she has seen many, many different systems around the world. And her assessment is that instead of taking, as it says here, instead of taking a forward-thinking, almost preventative approach, many organizations, either through choice or circumstance, are investing the bare minimum in technology to move forward instead of imagining, as she says, the art of the possible and preparing for that. So rather than make do with an aging infrastructure, for some of you it might be a good time for your to build a good home for your high-end clinical applications. Maybe dream a little bit about the mansion while laying that foundation. One of the reasons that patient information gets shared for virtual diagnosing and monitoring of patients who are housebound or living in rural or remote areas, and one of our clients who has patients in that situation has told us that it can be 3 to 6 months a year where they are unable to be able to get to a hospital. So any advances in virtual care are really welcomed by the community in that situation. And today, more and more clinics and hospitals are finding themselves looking to deliver care in a virtual situation. They are finding that their patients cannot get in, that they are being hamstrung in terms of transportation. In some cities, it's not unusual to find people having shown up with their patient, the ambulance driver is now waiting 2-3 hours in a hall before people can get looked at. So the idea of being able to include more virtual care is looking very attractive to some. And as we start to look at that, it starts to spark discussions on whether that data should be put in the cloud, and most are saying yes, which now leads to discussions, should that be private cloud, public cloud, some kind of a hybrid. And as you might surmise from the cloud managed network name, this is an area in which we have expertise, and we would be very willing to provide you with advice moving forward. We're also seeing increased use of applications. And as we started looking at this, my apologies. We started. I think I've gone too many slides. No, I haven't. I'm just thinking one of the things I wanted to talk about here, my apologies for this. When we talked to some of the clinics, some of you were worried about what nuances in tone and posture doctors see when they're treating a patient, a person that gets lost long distance. So I thought this would be a good place to mention the cognitive collaboration product that Cisco offers. When people use WebEx to provide care remotely, there's an artificial intelligence and machine learning programs that can be running in the background collecting data that will actually help the users have a more realistic, almost a lifelike experience. They use facial recognition and voice assistance, and the program then starts to be able to identify what someone is really feeling. So when the patient says fine or fine, it's going to be able to provide the clinicians with tools to pick up on cues that they would have been able to see in person that might have been too subtle to be picked up in a normal electronic transmission. I attended a conference recently at which one of the speakers announced, "We are living in the age of the app." Again, none of us was too surprised by that statement. But what we are seeing is that apps are being adopted at different rates by different practices, and there seems to be little consistency from one facility to another in terms of how, excuse me, these apps are vetted, integrated, or even used in patient care or for admin purposes. In some hospitals, the hospital's clinicians are using them actively to get patient updates, check on new drugs, potential drug interactions, and otherwise treat patients. The administrators are telling us that they use them to get correct billing codes, but are concerned about being able to go to them too often and not 100% sure that they're not going to get some kind of virus by using these apps. We also know that people who are coming into the facility want to be able to have access when they can. And the more that we do this, and more people start to use the wayfinding apps, we see this is great, but they also create many more potential access points for hackers. It only takes one unsecured wireless printer or a doctor using his or her unprotected private smartphone on the hospital network to open up a great big security hole that a hacker can exploit, as Sina's going to tell you shortly. And unfortunately, the nature of hospitals and healthcare in general is such that there are many, many weak points. And once in the network, a hacker is going to be able to maximize this little exploit of theirs. And while it's easy to assume that all attacks come from outside, Sina's going to show you that may not necessarily be so. Another challenge that hospital administrators have been telling us about is the ability to be able to provide more efficient care so that people can get discharged more quickly, spending less time in the hospital, which is good for both patients and profits. So with some of the apps, clinicians can get real-time updates on their patients, often being able to provide information while they are still bedside. Other apps enable devices to be monitored from a distance, which is great when people are being cared for at home. But as I was reminded of the other day, and it's not been all that long, I think it's been 3 years ago, devices such as infusion pumps and heart monitors can be hacked very, very easily. And if they get hacked, now you're not just worrying about your network, you're worrying about the life of the person who's your patient, which I'm sure is another thing that keeps you up late at night. On a more positive note, apps such as this one actually help hospitals operate not only more efficiently, but more cost effectively. It's not unusual. We've learned that for some hospitals, the staff will hold on to and hoard equipment that they need so that they can provide it to their patients when needed. The biggest culprits apparently are infusion pumps and wheelchairs. They get hidden away the most, requiring hospitals to spend more on capital expenditures. And there's one hospital we spoke with, asked not that we share the name because of the situation, but they said by introducing this one little piece of tech, it helped their overall bottom line tremendously. But again, they had to consider how would something like this get added to the system. We're also seeing an increase in the number of patient-facing apps, and even if it weren't in the new provincial mandate, there's been a growing movement to help empower patients and encourage them to be more responsible for their own health care. And to support this, more and more apps are being introduced that give their patients and families access to lots of information and also enable healthcare workers to be able to coordinate care and appointments more easily. This is one of the ones that Cisco actually uses. It provides reminders, enables requisitions to be able to be put forward. And as you saw on the previous slide, there are also apps that help provide in-room phone and entertainment, which a lot of the people we spoke with are looking at now to help. They're looking at using their Wi-Fi systems, being able to add on to that, to be able to incorporate camera, and then working with other providers to be able to provide phone and entertainment that way. And this is something that we can talk about afterwards if you would like. As increasing numbers of patients, guests, visitors, frontline staff use the mobile device to perform their job, and as increasing numbers of people bring in their own devices to use, healthcare IT specialists are telling us that density problems are they're finding that density problems are tremendous, even though they did a heat map in the beginning. They're finding that the escalation of connectivity demands make it even more critical that they've got an optimal ICT infrastructure in place. And as you all told us, when I spoke to the people I spoke ahead of time, you're expecting your jobs to become more complex as healthcare comes to rely more and more heavily on connected devices and machines that actually talk to one another. I heard from many of you as well that tools and rules are needed. That was the phrase one gentleman used, and that some of you don't have the resources in place to work out all the policies that you need or to be able to communicate those policies to people once they get onboarded. And this is another area in which we can provide assistance. As part of looking at your network, we can provide advice, and as part of the ongoing relationship, help you with the training. I know that many of you are already vigilant, making sure that nothing accidentally infects your system. As you'll hear from Sina in a few minutes, sometimes the most seemingly innocuous thing can take down your internet or even take you out. So having your staff up to speed in terms of what they need to do is an important thing. And as all of you have witnessed firsthand, the biggest challenge to healthcare over the past 10 to 15 years has been the integration of information tech into care delivery, and there's no sign of things slowing down. The innovations in the clinical applications are great, but they may have a less than desired impact without the network connectivity that feeds the information and the people who use these applications to provide care. But as many of you pointed out, how can you identify where your information infrastructure gaps exist, and how do you determine how best to fill them? You weren't alone. So in 2015, Cisco started trying to answer this question when it introduced the Infrastructure Maturity Assessment. And this work was started with 30 major acute care hospitals, and it provided insights on how to benchmark hospitals as you went through your journey, learning how to apply information and to work the information infrastructure more effectively, and as well as how to support your staff, as well as the clinical and operational applications that they rely on. And then in 2018, you probably heard of HIMSS, HIMSS Analytics. They took over the development of the assessment and built the infrastructure adoption model, which is known as INFRAM. And Cisco has worked as a collaborator on the pilot program along with other organizations around the world. And what INFRAM does, it provides a framework for determining how prepared a hospital facility actually is to support the existing and planned process rollouts for their digital infrastructure. And if you're interested in learning more about this, Shanti Gadvani, the National Director of Healthcare for Cisco, will be talking on the topic shortly. So when we send you out a thank you note afterwards, I will include that link along with a link to a webinar that was given yesterday by the CIO of the new Smart Hospital in Vaughan. And he was talking about a lot of really interesting innovations that I think some of you might find worthy of considering for your organization, but makes it too long for this webinar now. This new Smart Hospital, it's going to open 2020 with all kinds of things that might once have been something out of Star Trek, but are no longer futuristic. Anyway, one of the things he was talking about yesterday was about hand hygiene machines and how you're going to track doctors who aren't washing their hands as well as the ones who are. And he thinks there'll be some very interesting metrics planned, but now he's got to work out how does he put that in with the rest of his system. Anyway, as you can see, Cisco is heavily committed to providing high levels of innovation for the healthcare sector and has solutions for almost every component, including transportation, as you can see on the screen here. The question we're being asked is, has it also allowed for things that are coming down the pipe? Have you? And in that case, you might ask yourself what's next in the area of healthcare. Much of what's on the slide is actually already in the marketplace. A lot of it is something that Cisco either delivers or can help deliver. But one of the things on the slide that I find really interesting is the use of VR exposure therapy. They've been running trials in California, and of the 60 and 20 servicemen who are being treated for PTSD, out of the 20 servicemen, 16 are already showing remarkable improvement, which is kind of cool. So as you can see, the patient experience is really important in healthcare today. The other challenges that have been faced by IT people, just to recap, are making sure the network continues to work robustly, that clinical workflow is smooth and as sufficient as possible, and that your whole system is protected. And we've been talking about the challenges you experience with all these devices connecting and the ones that are going to come down. But when you realize that by the end of this year, it's expected that throughout 2020, at least 1 million new devices will go online every single hour in 2020. You've got to know that what Sina's about to tell you is going to be important. But before I turn it over to him, we're going to open up the floor to questions in case anybody have one. And with that, I'd like to move on, and I'm going to ask Sina to let you know how you can protect yourself in this almost overwhelming second as I pass it over, this overwhelming new environment. Sina, I have now passed it over to you.
Thanks, Jane Michelle.
You're welcome.
All right, guys. So I'm going to walk through Cisco's integrated architecture and security approach today. And so just let me know if you are able to see my screen now.
Yes.
Perfect. So we all know that cybersecurity is a huge challenge in healthcare. I mean, it is with most organizations nowadays. The way threats come in have changed. The way that, hackers operate have changed. 10 years ago, you'd look at a hacker and it was someone who would come, or maybe even a little longer, would come and, break into your website, put their name on it, and go tell their friends about it. And that was really what we view as a hack, very mischievous. Nowadays, it's a full-time job. There are people out there that spend 8-10 hours a day sending phishing emails, customized phishing emails to multiple people within your organization to try to get you to click and get the latest and greatest ransomware within your environment. So having an integrated approach and a strategy around that is very important, and that's kind of the main trends that Cisco's seeing in the market nowadays. The same three questions keep coming up every single time. Are we safe? We don't have the right visibility. We don't know who is on our networks. We have BYOD devices. We have multiple sites. We have different types of doctors and administrators that need to connect. We have guest Wi-Fi. We have critical IoT devices that are connecting to the network, and we just don't have visibility. We don't know if we're protected from the next big breach, and we have very limited budgets and times. A lot of times, the folks that I talk to are the IT guy, who covers the phones, who covers passwords, the network guy, as well as the security guy. So you're putting on multiple hats, and it's hard for you to stay on top of the latest and greatest trends and stay on top of, making sure all the patches are fixed within your environment. So that's where you can lean on Cloud Manage and Cisco to assist you. So there's a lot of zeros on the screen right now. That's the average cost of cyber crimes, and that's actually the estimate towards 2021. Currently, that number is $3 trillion, and collectively around the world, we're actually spending less than $1 trillion, so less than a third of that to try to prevent this from happening. So as you can see here, the bad guys are winning. In Canada specifically, the average cost of a breach is $243 per person per breach. So again, pretty big numbers if you consider the fact that, having a good backup strategy, having a good security strategy from the beginning, doing some of those testings on your environment to see how quickly you can come back up if you've been breached, becomes very crucial in these instances. So I'll walk through some examples here, and I tried to keep them pretty focused to, Canadian and healthcare. So I'll start with Norfolk General Hospital. It's a little bit older, it's 2016. In this case, they were unaware of the breach. It came into their environment. They had no visibility into it. It started sending ransomware and malware to the visitors of the hospital as well. And it all tied back to unpatched systems. So you hear this so often where there's no visibility into seeing if the latest version of Chrome has been updated on everyone's laptop, or if Windows has been updated, and what's happening here is these hackers are using these vulnerabilities to get into your system. Same kind of feedback we got from their IT team here, in the sense that there were budget restraints, and that was the main reason why they hadn't looked at cybersecurity in a more holistic view. Town of Wasaga Beach, a little bit more recently. I'm sure you guys all heard about this one in the news. They were hit by ransomware. The big thing I'd like to highlight here is their SQL Server backups were actually located on-prem. So even their backup was hit in this case. So whenever we talk cybersecurity, and Cisco doesn't even offer backup, we have partners in the space that do, but we always preach having a good backup strategy. It's important to make sure that you're protected, but it's also equally as important to make sure that you are, protected for the worst case scenario. Again, another example with Sega that Midland actually dealt with when they got breached was cyber insurance. Again, something Cisco and Cloud Managed don't offer, but it's a good idea to look at your cybersecurity policies or to look at your insurance policies to make sure that there is a section or a clause covering off cyber insurance, and having that conversation with your broker just in case something happens. At least it's that the money is coming in from the insurance side of things. They paid $35,000 to get their access to their data again. They paid the ransom, but the overall cost of the breach was over $250,000. So you can see here the variance between $35,000 spent just to get their data back, and what it actually cost them in terms of downtime, re-imaging, making sure the virus was blocked, incident response, and the rest. And by the way, we don't recommend you pay the ransom. It's just like real ransom. There's no guarantee that they'll give you access to the data even after you pay it. And if you are paying the ransom, now they know that you are someone that will pay. So you become a bigger target moving forward. Delaware guidance systems here. So this is a children youth site services. Personal information was affected again in this situation. The data was disclosed to the patients directly, and they had to hire a security firm to help them remediate and recover. So, again, lots of money spent here in this case to be able to get back to day one. Care Partners, I'm sure you guys all heard of this one in Canada as well. This was a really bad example where they actually not only got personal information about, the people's health conditions, but also information about their financials, their T4s, their contact details. Care Partners actually came out and said that we've put in, we're not sure that this happened and we don't know what kind of data they had. And in this case, the hackers actually contacted CBC and provided samples of the data that they had taken. Very common situation, again, 2-year-old software vulnerabilities, and they had to fix the patch. All right, and HSN. So this is again another recent one. This is northeastern Ontario. Actually, this attack caused Health Sciences North to shut down their systems, which affected around 24 hospitals. The good thing in this case was they were able to successfully prevent the malware from actually causing any sort of damage. But the main damage that was done was the fact that they had to shut down their systems, reschedule surgeries, change radiology schedules. And, that's a huge annoyance and an inconvenience for not only the patients, but also the doctors and the staff. And you can see here was a 0-day attack in this case. So who do we call? Who do we call when all this stuff happens? We call the police, right? It's hard for our officials to be able to track these people down. In this case, Riverside Fire and Police Services got hit with ransomware. They didn't pay the ransom, which is again something our incident response recommends. But you can see here they lost 10 months of evidence data in this hit. People were acquitted. Criminals got off scot-free because the evidence was just not there to convict them. So you can see here that even our police services is someone that are targeted on a regular basis. So what are Canadians saying? I think the big takeaway for me is when you look at the bottom quote here, we can't prevent it. We can't create a Fort Knox. It's impossible to make sure we're stopping 100% of everything. So going back into the idea of making sure we have as much visibility as possible, we're doing as much segmentation as possible within our networks to separate guests from admin. We're making sure we're always trust verifying and we have that backup. So we're as strongly postured as we can be to try to prevent the next big attack. Ransomware is an epidemic in the healthcare industry. We're seeing it all the time. And again, Jay Michel spoke to the fact that, health providers are getting more complicated. You have multiple rooms, guest Wi-Fi's. We have labs, IoT devices, BYOD devices, multiple offices and sites connecting to the main site or to satellite sites. It's a lot of different pieces. There's a lot of moving pieces, a lot of people, and there's a lot of weak links within that. And having that visibility, again, becomes crucial here. The same stuff that you see in territory space we're seeing in healthcare, right? You have some of your critical applications sitting on Azure and AWS. You have SaaS-based products that you're accessing for patient care. We're looking at remote offices. And again, these things, every piece of this adds more complexity. So what's happening is our people, our partners are going out into the marketplace and looking for security solutions and trying to buy more security solutions to keep them protected. Well, what ends up happening is you get this cyber landscape that's massive. There's lots of different players that play in different pieces of your security posture. And what happens is none of these products really talk to each other. So you get into an area where you have 5 or 6 different vendors with 5 or 6 different contracts expiring at different times and products that aren't speaking to each other. And what we found is when you do that, the more products you add in itself causes the complexities that you're dealing with from the beginning, right? So 55% of the customers we surveyed in 2018 were using 5 or more security networks or security vendors in their network. And the average cost or the average time for detecting a breach is still around 100 days, which is pretty crazy if you think about, some of these new bugs, polymorphic emotet, for example, that came out a few months ago hitting the manufacturing sector, which only take minutes to infect an entire network. We had a client who had 24 servers and 500 endpoints completely encrypted in a matter of half a day. So 100 days of detection is just not cutting it anymore. So Cisco has an approach here. Cisco follows NIST principles, and we look at security in a two-pronged approach. Continuous threat detection, having the best security products and postures that speak to each other. At the same time, continuous trust verification. And what we use is a product called Duo, which is basically an MFA, multi-factor authentication, making sure that the person on the other side trying to access these critical applications or healthcare records or Wi-Fi is the person that they say they are. And we have an integrated infrastructure approach that we present with Cloud Managed here. The idea here is whether you're looking at network protection, endpoint protection, or cloud protection, we have products and services in that space that can help you. But most importantly, all of these products and services are tied together through an organization called Cowls. Cowls is the world's largest threat research group. Outside of the government agencies with 3 letters. So you think of the CIAs and the NSAs of the world. We have over 300 full-time threat hunters. These are ex-military, ex-hackers, PhD. And their job is to sift through all of this data. It's a 24/7 operation, and they get access to everything that Cisco has to offer in terms of security, as well as our traditional routers and switches. All of that telemetry is anonymized and actually gets sent to this group for real-time analysis. What that means for you is you have, whether you're purchasing 1 or 2 endpoint products, AMP, for your hospital, or you're deploying an enterprise-level security architecture, you get the same level of protection on the back end with our Cowls Threat Intelligence Group. And what this does is it gives you that visibility and that ability to look at before, during, and after any sort of threat or any sort of, communication taking place within your environment. You can see here, web and reputation filtering. We have AMP and Threat Grid. If you're looking at the SaaS visibility, we have the CASB solution for that. If you're looking at, web page and making sure that we're blocking, payloads from being downloaded or command and control from happening, we have a product called Umbrella. And again, all of these different solutions are speaking to each other in real time and giving you that telemetry and giving you access to the latest and greatest bugs in the marketplace. So the architectural advantage is very simple. The way it works is we see a threat. It doesn't matter where it is. It could be anywhere around the world. It could be a brand new threat. We see it once on an endpoint, let's say in Switzerland, and this is, a real example in this case. What we do is we block that threat and in real time send that intelligence over to the AMP cloud and the Threat Grid cloud, and it's enforced everywhere around the world with all of the clients of Cisco that have any of our security products. So threats seen in Switzerland and in Markham, in Canada, in real time, you are getting protected from that threat, and it's not unknown anymore, and all of our clients now have the benefit of getting access to that data. Really the biggest advantage of having products and services that speak to each other. So I want to talk about, there's multiple solutions. Again, we, like a couple slides ago, we looked at a few different options in terms of what we have in, the healthcare space that can assist. But I really want to focus in on a few products specifically. And I'll start with that, Cisco Email Security, Umbrella, and AMP would be the focus moving forward here. So Cisco offers very robust email security, and the reason is still 99% of threats are still coming in via email. Most malware nowadays are coming in via email to your weakest link. People are doing their research. They're coming up with these great email templates and sending them over to you, and no one's immune. This is one that actually got sent over to Cisco Corporate. End of the quarter, an email comes in from what looks to be our office admin saying, I'm out of compliance. We do monthly, security hygiene checks with our employees, and we still had about 15% of our staff click this email thinking that they were out of compliance and they needed to do this. This is very typical. We actually get a lot of compliance emails or tasks that we have to complete. So very well or very cleverly positioned to make people click on it. Here's another example. I love this one because it tugs at your heartstring. It's the revision to the remote work policy. How many people don't want to work from home or more often? How many people love the idea of being able to work from home? So, of course, you get a lot of people, in this case 20%, clicked on this email to see what the changes to the remote work policy were. So you can imagine here, if the right security products weren't in place, in this case, if Umbrella wasn't in place to stop the command and control call out when you clicked on the link, or Cisco email security wasn't in place to prevent this email from coming into your organization in the first place, what kind of damage this could do and how simple it is for them to get into your network. So Cisco Email Security really is a simple SaaS-based solution to implement. If you like the traditional hardware approach, we also have, a physical appliance you can plug in through your Exchange server as well. And what it does is it monitors all aspects of the email. It looks at the file, it looks at the web, it looks at the link, it looks at the sender's name, and it makes sure that it's tracking information within the body of the email as well. Part of our advantage with, or part of the main advantage with Cisco Email Security is the zero virus guarantee that's actually available with all of our cloud security products. The next product we're going to look at here is Cisco Umbrella. And Umbrella, the way I look at it is your first line of defense. Umbrella is an agentless client that will sit on your endpoints. It will sit within your environment, and you just have to point your DNS traffic to it. And what Umbrella does a really good job of is preventing those command and control callouts from happening in the first place. It also gives you great visibility into shadow IT, so you can see what websites people are going on. You can limit those sites, and at default, you can set things like crypto mining to be off, file sharing to be off, people using off-the-shelf or VPN to be able to kind of get past your firewalls. We can actually prevent things from happening as well. It also gives you the CASB solution of being able to track to see if sensitive information is shared via any of those file sharing sites and or email, and actually prevent that from happening as well. So there's a lot of great functionality you get out of this, and the entire platform can be launched in minutes across your entire organization and plugs into your Active Directory, giving you that visibility. So think firewall for when people are on network, and Cisco Umbrella for when people are off network, with the same level of protection that you're giving them while they are on. The implementation of this is super easy as well. We talked about, looking at predicting and preventing threats. One of the things that Umbrella does a great job of is opening up new threats in a sandbox in real time. Because we have multiple data centers pointed to Umbrella around the world, when a new URL or an unknown URL is clicked on, what happens is in real time, it's actually opened up in a sandbox, and it's tested to make sure that it's not a malicious URL. If it is, the block happens immediately, and if it's not, the user is able to access that site in real time. Again, not affecting performance for your users, but at the same time giving you that protection from the unknown. The last one I want to talk about is Advanced Malware Protection, or Cisco's AMP for Endpoints. Actually, AMP can be deployed in multiple areas within your organization. It doesn't have to be an endpoint product, but it is, the claim to fame for AMP is that it is designed to be a really strong endpoint product. And it's not just a traditional, AV or antivirus. It actually does more than that. It gives you the ability to look at a file and actually be able to respond to and remediate that file as well. So it's almost like an AV on steroids, and it gives you a lot of extra functionality. One of the biggest things that we look at here is retrospective file analysis, and the ability for AMP to look at a file within your environment, say that it's unknown or maybe it looks clean and let it in, and then track that file for an unlimited number of days. So let's say that file, after a month starts becoming a 0-day, trying to, move across within your network, go from the endpoint to a specific, part of your network that it shouldn't be. At that moment, we're looking at the DNA of this particular attack and saying, we don't know what it is, we don't know what this file is, but it's starting to act as if it's a virus. And at that moment, we're going to actually retrospectively block it, send you the information, and you have all of that available so you can kind of log in and look at it, or just trust that the product's doing its job and it's blocked and it's removed it from within your environment. I'm going to open these up here for you. So back here. So, we talked about blocking threats. You have the ability, if you have a CISO, if you have a lot of, people within your organization like CIBC or Turkish Airlines, to be able to log in and actually do your own threat hunting as well. It does have dashboards. It is designed for you to be able to do workload management. But again, in many organizations, these features aren't used. The system is set up through our, professional services, through cloud-managed professional services. We make sure that it's fine-tuned within your environment. We test it and we deploy it, and a lot of times you don't have to log back in again. You have real-time alerts. We guarantee 1 in 1 million false positives, so you're not getting a lot of, unnecessary noise coming to you. And a lot of the heavy lifting is done by the product itself. Oh, sorry, guys. Here we go. So where AMP plugs in, and, I talked about this a little bit at the beginning there when it comes to endpoints, but you can actually connect AMP to email, AMP to firewalls, AMP to Umbrella. And the benefit here is you'll get that same level of trajectory across everything. So it's just giving you that single pane of glass within the AMP console or within Cisco's threat grid, Cisco's threat response, to be able to do your modeling, be able to do your convictions, whitelisting and blacklisting across multiple products using one single pane of glass. So one view giving you access to everything you need access to. I'm just going to open this up here as well. So here we go. So the idea here is, we're looking at many different features, exploit prevention, fuzzy fingerprint analysis, deep file analysis, right? Looking at and replacing your traditional antivirus. And again, machine learning, talking about the anatomy of a threat before it happens. And, in this case, it's looking at behavioral analysis of those different viruses or different files within the environment in real time to see if it's starting to behave funny. When you're looking at behavior analysis, we're also looking at things like low prevalence. We're looking at, mapping out the actual behavior that's happening. That's actually beta, but it's being launched as of next week. Compromise detection. So there's a lot of, advantages that you're getting from, implementing AMP in your environment, a lot of visibility that you're going to see here as well. And then finally, incident response. So, looking at something like at the device trajectory, like where is it within your organization? How many times has your director come to you and said, hey, I heard about the latest WannaCry in the Toronto Star, are we protected? And then you're scrambling to jump into multiple platforms, tracking the firewall traffic to try to figure out if it has actually infected the environment. With device trajectory, it's 3 clicks of the mouse. You can copy and paste the link of the latest and greatest virus from the Talos blog and actually plug it into the dashboard, and in real time, it'll give you back all that information to say, no, you were not infected, or it had made attempts to come in through these specific machines via this email address or against this firewall. So with Cisco, we're trying to change the equation. We're trying to say, what are the questions, what are the problems that you're facing, and what are the vulnerabilities that you think are existing in your network? and let's look at those. Let's see what products and services and what expertise we need to provide to ensure that we're plugging those gaps, make sure that we're giving the visibility that you're looking for, and you're working with the premium partners like Cloud Manage to be able to ensure that you're protected, but also covered in case you need to have, your backup strategy and your posture assessed as well. Excellent. So I'll continue here. So again, the Cloud Managed approach is Cloud Managed is one of our premium partners in the marketplace, and they are so because they're as Jay Michel mentioned, a Cisco shop through and through. So whether you're looking for enterprise grade security products, you're looking to implement SD-Wan strategy, anything from switches all the way down to security cameras. Cloud Manage is able to provide that information and provide you assistance with that. So it's a very holistic approach that they take when it comes to healthcare. And so you're not just looking at Cisco for one piece of the puzzle. You're actually looking at your entire infrastructure, everything from security to collaboration to things like access points.
Sina, thank you very much both for that wonderful overview of the threats out there and security, Cisco security offering and of our services as well. I do want to say that although we are cloud first, we are not cloud only. That's not my line. I heard it at a partner Cisco presentation fairly recently, and I thought it was perfect because it describes us perfectly. And thanks to our relationship with Cisco, we are able to work with other vendors any of the other vendors that you may have in place already. Sina, I can't advance my slide. Can you pass it? Thank you. When we start working with our clients, our first step is to do an assessment. We talk to you about your needs, your pain points, your long-term plans, and your immediate goals. Next, we look at what you have in place and assess that in the context of what you've told us. We then determine the best way to help you achieve your goals without having to replace equipment unnecessarily, all the while keeping your budgets and timelines in mind. As part of that assessment, you look at where you might be vulnerable and where you might be at risk. And to do that, we start with pen testing, and this is a service we offer for free, even if you don't become a client. We'll figure out where the hackers can get in, and we'll let you know what needs to be done to try to minimize the likelihood of that happening, because no one can tell you 100% they're going to guarantee it, but we're definitely going to give you a very, very good shot against it. And we will let you know where you are truly vulnerable, as well as what needs to be done by when. And if there are some elements that you can ignore safely, we'll tell you that too. And then we will give you a rollout plan if you need to phase in the changes that are to be made. We will also attempt to give you a financial assessment of what you might have at risk if you choose not to proceed. And with PIPEDA being enforced more strongly than ever before, as well as the requirement to disclose if there's been a breach, you need to make sure that you're compliant and that you have a plan in place for protecting your network. So as part of that, we will also assess your backup and restore capabilities. In healthcare today, end users expect access to data and applications at all times with no downtime or data loss. And we find that many organizations back up their systems pretty regularly, but have never tested anything or not done it very often to see how effectively or quickly they can be back up and running if disaster strikes. Excuse me. The goal should be to deliver a recovery time objective and a recovery point objective of less than 15 minutes for all applications and data. And we're able to do this with Veeam, which is one of the Cisco products we offer. And as I said earlier, we do all this while keeping your budgets in mind. So to recap, I'd like to say that we are cloud experts, excuse me, with extensive public sector experience, and we are OECM members. We're also members of TrustX, which enables us to serve any or all of your IT needs. But more importantly, most importantly perhaps, we value the relationship that we have with our clients, and we'll do whatever is necessary to serve your needs. And we do indeed hope that we get to serve those needs one day. So before signing off, though, I'm going to open up the webinar one last time in case somebody has thought of a question after Sina was finished.
Hi, I do have a question. Can you guys hear me?
Yes, we can. Thank you.
Okay. So, I mean, it sounds like it is possible to do this, but I just wanted to confirm because it's traditionally been a pain point of mine. So we have our corporate network in our head office, and we have a few different satellite offices. And then separately from that, we have our cloud deployment in Azure, where we host a proprietary app running on Ubuntu servers. Um, what you're talking about with AMP and Umbrella and all those Cisco solutions, could it work in a way where I can see sort of everything in one pane, like the app and the corporate network? And does AMP work also on those Ubuntu servers?
Sina?
Yes. So AMP definitely will work on. I have to look at exactly the configuration. So I'd say in many cases I've seen AMP work on proprietary as well as competitive servers and switches. We just need to make sure that it's part of the list of the ones that we actually support. In terms of getting visibility into your custom applications as well as anything hosted in Azure, absolutely, right? We just need to look at what kind of security posture is set up there currently and, really what we need to implement to ensure you're getting that visibility, whether Umbrella is the best solution for that or whether we need to look at like a virtual firewall for Azure to give you that type of, granularity.
Mm-hmm. Okay. And in terms of, backup strategies and disaster recovery and things like that, it's almost like I have to do two separate ones every time, one for the proprietary app and one for all the corporate network. Like, is there a better way to do that?
Have you spoken to a Veeam by any chance? Veeam?
We can arrange to have have you speak with one of the Veeam experts, because that would probably be the easiest thing for us to be able to help you to do a demo, have them come and talk to you about that.
Mm-hmm.
Exactly. Yeah. They're very good at doing multiple. I mean, I've seen them do this in many scenarios where they're doing backup from multiple different things. So email as well as, physical data centers and custom application, and automating that backup to ensure that it's not only backed up in a physical hosted environment, but as well in the cloud so that you can very easily come back up and running again if there's ever an issue.
Mm-hmm. Okay. That sounds pretty interesting. I know we do use Veeam on our corporate environment, but not on the Azure side. So I'll have to look into that.
For sure.
Okay, thank you. Are there any more questions? In that case, then, on behalf of our company, Cloud Managed Networks, and our partners, Ingram Micro and Cisco Canada, I'd like to thank all of you for having joined us today. And I'd also like to thank Sina Radford for being such a wonderful co-presenter. Thank you very much, Sina.
It's my pleasure.
Thank you. If you have any questions, I can be reached at the address you see here, or you can call the number that's on the screen and ask for the person who invited you originally. I hope I have the pleasure of getting to work with each of you, and in the meantime, I wish you a wonderful weekend. Thank you again for having joined us.